Hi, everyone. I'm Dr. Stan Oleksinski, a family physician here in Prince Albert. I just want to give you some recommendations on what to do as patients out in the public in terms of getting care in this crisis of COVID-19. We do recommend that you call your family physician's office first, and there's a few reasons for that. We want to have as least exposure as possible to the general public and patients for mingling together. So if you call ahead first, appointments can be made. They'll also try and deal with your concerns over the phone first, if at all possible. And if you need to be seen on a more urgent basis, they will make arrangements for you to be seen either at their office or, if it's more appropriate, at an emergency room or at another location. If you possibly might have COVID-19 yourself and you're having some questions, they would field those questions and answer your concerns. Again, if you need to be referred for testing, your family physician would be able to refer you to a site close to where you live or where you are. So those are some of the things we want to do. If it's for non-urgent things, your family physician would be able to answer most of your concerns over the phone. They'd be able to refill any prescriptions that you might need as well. Some family physicians in their office are, when somebody does come to the clinic, are getting you to leave your phone number and then having you wait in your car until there's an exam room open in their office, and then having you come in to try and eliminate people being close together in the public. So these are some of the things that can be done. You can, of course, call 811 if you have questions about COVID, and you can also go on to the COVID-19 website for Saskatchewan as well. We want to remember if you've been away and out of country or have been in contact with somebody with COVID-19, that you stay at home and self-isolate. If you get a fever or cough, again, call your family physician and they will give you advice on what to do next. For everybody, please stay home if you can. If you can't, then maintain social distancing of at least 2 meters, and remember rigorous hand washing after you've been in contact with any surface, and as soon as you return home, you should be washing your hands with soap and water. We want you and your loved ones to be safe. Everybody stay safe. Thank you.
Good afternoon. My name is Dr. Khami Chokani. I am the Medical Health Officer for the Saskatchewan Health Authority here in Prince Albert. As we now get into the pandemic as it is proper, I think it's very important that we realize that in order for us to weather through this pandemic, we need to work together. From a public health standpoint, various measures have been provided and instituted in order for us to be able to weather through this pandemic. There is no doubt that there will be a lot of hardships, but a better pill has got a very good outcome. We have asked, for instance, people to not only just do social distancing, but do an actual physical distance. This is so crucial. Why? It is the crux of the ability to mitigate the impact of the pandemic that we are facing. We do know that by a sustained effort of people ensuring that they keep 2 meters away, that they avoid any groups that are more than 2 to 5 people, has a significant impact on the numbers of people that are infected by the virus within a fixed period of time. We do know that, yes, we've only got finite resources, but we need to be able to let them be able to provide that ongoing care that is required while we fight this pandemic. So, in addition to not only physical distancing, we have also insisted that the great thing that we have to do is to wash our hands. Wash our hands, and avoid touching our face, in particular, around your eyes, your mouth, rubbing your nose. All of those things are areas where the virus can enter into your body and cause an infection. So that's just two of the things that we hope that each one of us has a responsibility to do, because no matter how old we are or how young we are, we all have that one part to play. As we go on through this pandemic, yes, there will be those who get sick. And if you do start feeling unwell, please do the self-assessment tool that's available online, call 811, but most of all, make sure that you communicate, because if you go into one of the health facilities, you are putting everybody else at risk, and that we don't want to do. We are all responsible for making sure we all get through this together, and we can only do it by being responsible.
Hi, Dr. Randy Friesen here, and it's my pleasure to speak to you today on behalf of the healthcare workers and administration in Prince Albert. I want you to know that there are literally dozens and very soon to be hundreds of people who are going to be working on pandemic work in our city. A tremendous amount of work has been done over the last few days to get us ready for some tough days. You need to know that we have thought about what our patients need. We've thought deeply about all of our patients that are going to come to us from outside of town, patients with special needs, patients who have increased risk. We've also been thinking about our healthcare workers and the risks that many of us are going to be facing in this work. We're taking this as the most serious event we've ever faced in the healthcare system in this community and probably in this country. I just want everybody to know that we've got your back. I have been so impressed and amazed at the hospital staff who have risen to the challenge and who have said, I'll do whatever it takes to get us through this. I'm also grateful to our civic government who has pledged their full support for everything we're doing and everything we're going to have to do in the weeks to come. So I thank you all, and I just hope and pray that we will all hang in there together, give each other a little bit of extra slack, and of course, follow the rules. Thank you.
Hi, I'm Dionne, the Mayor of Prince Albert. My message is going to be a little different because I'm going to talk to the children. But at the same time, I want the adults to listen. As you kids are taught, we see with our eyes, we smell with our nose, we talk with our mouth. But that's how the virus gets into our body. It's through one of those three mechanisms. That's why it is important to keep your hands away from your face, because it can also be picked up. And as the previous people have said, wash your hands. And it doesn't matter how many times in a day you wash your hands, you're not going to hurt them. The key is keep clean. And when you're outside, and you're going to go outside, we can't stop you, but when you're playing and a bunch of friends want to come over, you have to say no. It's important that we self-isolate. And even though you may know them as your best friends, we know where they've been, you don't know the other 100 people they've been in contact with. So it's very important that we wash our hands and we keep a social distance away. And things are continuing to change, and that instructions may even change more tomorrow about self-distancing. But I just encourage everyone, please, this pandemic is not going to go away. It's going to get bigger. And if we can't stop the curve, that's when our healthcare is going to be in trouble. So far we're managing it, but it's getting close to the top. So it's very important that we take these safety measures. So please, think of your friends and your neighbors and your relatives, and wash your hands and stay a safe distance away. Thank you.